How many of you are pregnant here? Were you on birth control or was it planned? Okay. Each year, about 1 million teenagers in the United States, approximately 10% of all 15 to 12-year-old women become pregnant. Of these pregnancies, only 13 are intended. Now, I want to have some options for you to help to stop teen pregnancy at an early age or unplanned. Birth control can help put a stop to unexpected pregnancies. Today, I have 4 different types of birth prevention options for you, brought to you by the Help of Birth Control Group. Hello, my name is Susan. Just like some of you, I have had a child at an early age. It is a struggle to do, am I right? That's why I joined this organized group to talk to you about the types of birth control out there for you. In no particular order, there are several different options I will speak about. First, I'm going to talk to you about NuvaRing and how it works. NuvaRing contains 2 types of hormones, estrogen and progesterone, which work together to prevent your ovaries from producing mature eggs. These are the same hormones found in the pill, as they work the same way in your body even though they are administered differently with NuvaRing. Which NuvaRing hormone release is activated once the ring comes into contact with your vagina. The hormones are then absorbed and distributed into your bloodstream when used as directed. NuvaRing works as well as the pill. It is 99% effective in preventing pregnancy. In 3 weeks, the ring releases repetitively small doses of progesterone and estrogen. With these 2, you need high doses to prevent yourself from pregnancy. Therefore, you need to take out the NuvaRing every 3 weeks on the exact day it was inserted on that week. You always need to know the side effects if you notice while taking NuvaRing, because you want to find the right birth control that will work for you and not make you feel sick. Some side effects of NuvaRing include blood clots, heart attack, high blood pressure. There are also pros to every birth control. Organs and breasts, gallbladder disease, lipid metabolism, and inflammation of the pancreas. Let me break this down for you. Vaginal infections and irritations, vaginal secretion, headache, weight gain and nausea, vomiting, change in appetite, abdominal cramps and bloating, breast tenderness, irregular vaginal bleeding, rash, change in menstrual cycle, depression, nervousness, or weight changes. People always ask, how effective is NuvaRing? If NuvaRing is used according to the directions, your chance of getting pregnant is about 1 to 2% a year. This means that for every 100 women who use NuvaRing for a year, 1 or 2 will become pregnant. Your chances of getting pregnant increases if NuvaRing is not used exactly according to the directions. Let me show you what NuvaRing looks like. It is very small and it fits in your hand. If NuvaRing doesn't sound like a good option for you, no worries. There are many other types of birth control. Who here is scared of needles and shots? Okay, I can tell you that I am. I've had bad experiences of getting a quick shot and getting very lightheaded and fainting. I just don't like the thought of needles. It gives me a fuzzy feeling inside. With this being said, for those who said they aren't scared of shots or needle, here's another option. Another popular way of staying safe is getting a shot every 3 months. You may have heard of this shot, which ladies call it the Depot shot. It's short for Depo-Provera. The shot holds progesterone just as the NuvaRing I told you which it does. It's the hormone which stops your ovaries from releasing eggs. The difference with the shot is how it thickens your cervical mucus. Doing so helps block the sperm from going to the egg in the first place. If you're scared of needles, then you don't have to worry because there's more ways you can prevent pregnancy. This you don't have to worry until every 3 months though, whereas the NuvaRing, it's every 3 weeks. So it's up to you what you think would work easier for you. The normal cost for this shot is reasonably priced, $35 to $75 each time you get the shot. The depot shot is also 99% effective. A common question women have is, how soon is the shot effective? The depot shot is fast, effective, right after given within the first 5 days of your cycle. It is effective. Side effects people can receive are irregular menstrual periods, headaches, depression, nervousness, change in appetite, acne, excessive growth of facial hair, weight gain, hair loss, and loss of bone mineral density. Most of the side effects aren't common. However, your change in your menstrual cycle will be the most common side effect. If you stick with the depot shot, after a year, almost 50% of women will stop getting their periods. Their periods will return whenever they choose to quit taking the shot. And, most people don't like periods, so that's a good thing. Even if you aren't a fan of shots, the depot shot has a lot of positive pros. As I said, the cost, $35 to $75, that's really cheap. The depot shot is also 99% effective. It doesn't get in the way of your sexual activity. It gives you a long-term protection as long as you get the shot every 3 months, obviously. Lastly, you don't have to remember to take it every day like the pill, or change it every 3 weeks, or use it before intercourse. The main disadvantages that stand out by using the depot shot would be 2 things. It would be inconvenient for yourself to be making irregular doctor visits. If you're a very busy person and you don't have time during their hours, then you may have to think if this will work for you. The other is if you plan on getting pregnant, you would have to stop taking the depot shot several months ahead of time of when you plan on getting pregnant. Thank you. Hi, I'm Rebecca. I'm here to talk to you about another option of birth control there is out there. I have a long-term goal I have set for myself: graduating college, finishing off paying my car, and buying a house. With all my goals, I can't imagine having a kid right now with all my long-term goals. How many of you don't plan on having kids within the next 5 years? Okay. If say yes, there's a perfect birth control out there for you called Mirena. I've been on it and I love it. If you don't have to remember to take the pill every week or every month, it's effective for 5 years. You're probably asking, so what is Mirena? It sounds too good to be true, huh? Well, it's smaller than your hand, and the doctor will insert it into you. It's a soft, flexible IUD that releases small amounts of hormone locally into your uterus. Let me show you a photo of how small it is. It is also 99% effective on pregnancy. You have to have your doctor insert the small T-shaped, soft, flexible plastic into your uterus. It becomes effective 3 months after it's placed into you. You will visit your doctor at the 3 months to make sure it is working. Then you're done. No more doctor visits. No need to remember to take anything. You can also decide to take it out less than 5 years if you would like, but it only lasts up to 5 years. You need to remember that. You can also, after you have it removed, you're able to get pregnant right away. Right now, around 2 million women are using Mirena. I choose Mirena due to the fact I'm so busy and I don't have time to remember to take another birth control every week or every month or go see a doctor. If you're like me, I would definitely recommend Mirena. You're probably asking yourself, Well, what's the price for this? The price is $300 to $400 every 5 years. However, 3 out of 4 people with health insurance have coverage for Mirena. If you don't have $300 just sitting around your pocket like me, most doctors do have flexible payment plans. Commonly asked questions are, what are the side effects? Discomfort during placement, which would be pain, dizziness, or cramping, happen only during the placement. If it lasts more than 30 minutes, then it may not be placed correctly inside of you. Your healthcare provider will examine you to see if you need it to be replaced or to be removed. Other side effects are missed menstrual periods, changes in bleeding, pelvic or abdominal pain, but less common side effects would be headaches, acne, heavy periods, depression, nausea, breast pain, vaginal discharge, nervousness, back pain, expulsions, swelling of your feet or hands, skin irritation, anemia, pain during intercourse, decreased sex drive, weight gain, high blood pressure, and that's about it. That's a lot, though. Everyone responds differently to every medication there is. So if you have any other side effects, one responds differently to... so if you have any of these side effects, you would talk to your healthcare provider, your doctor, about if this birth control is right for you. I must say, some girls want some of these side effects, like your boobs growing bigger on birth control, or your period being lighter, less heavy. Even some doctors will recommend going onto birth control for girls who have terrible periods, where it's so painful, or words can't even describe what it feels like. Other girls would definitely choose another form of birth control if your sex drive goes down, because that's no fun. Am I right? On this topic, another question ladies usually have to ask is if their partner will feel the Mirena during intercourse. The answer is no. Mirena is placed into your uterus, not your vagina, ladies. Furthermore, another option you have a birth control is the pill. What is the pill? Birth control pills, also known as oral contraceptives, are prescriptive medications that are taken by the mouth to prevent pregnancy. There are many different birth controls out there because everybody's bodies act differently, so you have more than one option to choose from by choosing to be on the pill. The pill would be a good option for yourself if none of these 3 appeal to you. Do any of the other options appeal to you? Okay, so some would say no because some people first don't like shots, or just knowing there's something inside of you doesn't sell well with others. With the pill, there are many different brands out there for you to find one that will fit you perfectly. The only thing you have to remember about taking the pill for birth control is that you have to. You need to remember, I repeat, to take it every day at the same time or around the same time. I can't stress that enough. For the pill to be 99% effective. So, with choosing the pill, birth control, you must not to be forgetful or fall off track, because it is up to you how fully effective this birth control can be. About 8% of women who take the pill become pregnant unintentionally each year. In most of these cases, the women forget to take the pills. Yet, when used perfectly every day at the same time of the day, only 1 in 100 women have unintended pregnancies during the first year of using the pill. The pill will come in a packet looking like this. That will tell you Monday, Wednesday, Thursday, Friday, Saturday, Sunday. There are 2 main types of birth control pills: combination pills and progestin-only pills. Almost all pills are available in both in a 21-day or 20-day pack. They're usually classified on the amount of estrogen or the amount or type of progestin. Which 2 types With, with two types, there are over 30 different name brands of birth control to choose from. So you're probably asking, what is the combination pills? Combination pills are a birth control method that includes a combination of estrogen and progestin. They are very effective, like if you take it correctly. Most of the birth control pills out there are combination pills. Combination pills also come with benefits, which is why they choose the pill. These benefits are improvement in acne, shorter, lighter, and less painful periods. It may reduce the severity or frequency of your menstrual migraines. It may improve bone density in the years just before your menopause. It also can improve bleeding and pain associated with endometriosis and fibroids. It may also lower the risk of pelvic inflammatory disease. And last, it can lower the risk of ovarian uterine cancer. So, progesterone pills, also called the mini pill, only contain estrogen. So this pill is commonly used by nursing mothers or women who have pre-existing risk of blood clots. Just like I said, if you don't take it at the same time every day, the pill will be less effective. The pill, though, may be less effective in women with normal fertility. This is why mostly pregnant women will take the pill, because nursing mothers have less fertility anyways. So what are the side effects of this pill? A few common side effects of this birth control pill include nausea, spotting between periods, and headache. To see a full list of birth control pills, Google list of birth control pills or click on the link below. A few brand names out there are Aliza, Amitha, Biaza, Brevicon, Erin, Juno, Cariva, Lacini, Loestrin, Lorena, Natsia, Mononesia, Orthocept, Solia, Portia, Seasonal, Titelia, Tripicilia, Trivoria, Vesturi, Yasmin, Yaz, Zara, and Zencha. And I could keep naming many, many more, but I'm not going to. That's for you to look up and find out. I must warn you, though, and tell you that antibiotics and birth control do not mix well together. If you're taking an antibiotic for whatever your case, you may be sick or whatever, the antibiotic makes your pill less effective because there is a lower amount of ethanol estradiol in the bloodstreams. Doctors aren't quite sure why. It's not clear for them to see why they don't mix together. They are just sure for seeing people having failure with the effectiveness of with taking antibiotics with your birth control pill. So I'm sure you're wondering, what is the common price for this pill? According to Planned Parenthood, birth control pills cost between $15 to $50 a month, depending on a health insurance coverage and type of pill. Basically, the total cost per year would be a maximum coming out to $600 yearly. Now, after you know the main forms of birth control options there are, you can also know which one fits you. And are you able to see a doctor every 3 months to get a shot? Or are you able to remember to take a pill every day? Or do you plan on not having kids for a long time without all the doctor visits? What you know now that we have told you to help you learn to lean in the right direction to finding the perfect birth control for yourself. Thank you, and if you have any questions about any of these 4 options, let us know, or you can ask your main doctor. Thank you for your time and listening.